Dr. James Stelling, Medical and Laboratory Director of Reproductive Specialists of New York, works with women to teach them about PCOS and the symptoms they should expect if they have it.
Polycystic ovary syndrome is a condition where the women don't ovulate typically, as it's a spectrum of symptoms. Especially, it's usually there's three main criteria: erratic cycles, extra male hormone levels, which can either be by symptoms or measured in the blood. The third criteria is usually looking at if you do an ultrasound of the ovaries, you can just see lots of little eggs.
One of the symptoms of extra male hormones is extra hair growth, such as facial hair. However, sometimes it's the opposite, like the thinning or loss of hair, much like male pattern baldness.
I was a normal, healthy, active, athletic teenager until I was 16 when I was diagnosed with PCOS. And my mom had noticed that my hair was thinning, and I had noticed that I was bruising abnormally, and I had abnormal period cramps. They were really painful, and I was just in a lot of pain. Finally, when we had enough, we went to a GYN endocrinologist, and he diagnosed me with PCOS.
Treatments vary depending on the woman. For those who wish to get pregnant, fertility drugs are incredibly effective. However, for those who don't wish to have a family, or at least not yet, there are other ways of handling the situation.
When women don't want to get pregnant and they have polycystic ovary syndrome, it's very important that they see their body or uterus sees progesterone to prevent their uterine cancers and precancers. Most commonly, that can be done with birth control pills.
Kucharski was put on 7 medications to help relieve her symptoms.
This one's to regulate my periods. This one is to help my hair grow thicker and to stop my hair from falling out, but it didn't work by itself, so we had to add this one, and they work well together. This one is for my hair, skin, and nails. These two are for my period pain, to subside the pain. This one is to get rid of the rash that this one gave me.
Dr. Stelling says PCOS patients are at a higher risk of getting diabetes, which has recently become more common in America. In 2012, 9.3% of the population had diabetes, which is up from 2010. Diabetes remains to be the 7th leading cause of death in the U.S.
Not everyone with PCO has insulin resistance or prediabetes. If you do complicated testing at the research level, about 70% of women you will show who have PCO are insulin resistant. The more standard testing that we can do in the office will more show that about 30 to 40% of the blood work shows insulin resistance, meaning there's still some people you're missing by the standard blood testing. You'll actually find on a new diagnosis of PCO, about once they go 5% or about 8% are actually diabetic at that point, and they just don't know it.
There are a lot of risks that come with it. So I really like fast food, but I can't eat it too often because I could get diabetes more easily than the average person. So I have to be careful to try not to gain weight and to stay healthy, or I do have that risk of getting diabetes.
Unfortunately, there is no cure yet for polycystic ovarian syndrome. However, research has been continuing and will continue for years to come, and treatments are available and they are more and more successful each year. For Stony Brook News, I'm Kaylin Arnstein.